Hello, everybody. I'm Dr. Ben Edwards. Welcome to another episode of You're the Cure. I've got an amazing guest today, and I can't wait to get to him. But first, real quick, we've had this article come out. We've had lots of hate mail and phone calls about it, too. So I wanted to just try to bring some facts to this question about me treating measles kids while I had a measles rash. And we could spend a whole hour talking about all the nuances to this story, and we will. At the right time, we will talk about. Let's Monday morning quarterback this whole thing, actually. There's a lot to be learned here. But here's the situation. So this was a Saturday. I was called and asked to come down and see some kids that had no other access to medical care. And we need to dive into that question. Why didn't they have access to other medical care? Where were the other healthcare providers? And why wasn't treatment more readily available? There was a lack of compassion and common sense, but again, we'll talk about all that later. The facts were I was told there were some children in distress and they needed help and they had nowhere else to turn. I was not planning on going there that day, but I told them if we can limit this to measles cases only, young cases only, and respiratory distress or risk of respiratory distress, the sickest of the sick, and if there's nowhere else they have to go, then I'm happy to come down and see them because they already have the measles. Actually, this decision put no one at risk. And in fact, the exact opposite, because it kept these kids from potentially seeking out other healthcare options, even though they told me they weren't going to. They were scared to go to the hospital. But theoretically speaking, and for future emergency infectious disease breakouts, trying to keep patients out of clinics, urgent cares, and emergency rooms, I think would be a beneficial thing to do. And anyways, the call was made. And since I can't give measles to someone who already has measles, and I could potentially keep these children out of the hospital and away from harm and potential death, then I made the decision to do that. Again, there's a whole lot more to this story. I'm not going to go into that today, but I did just want to address that quickly. I haven't read the report myself. Very interesting timing. I do want to say thank you to some folks that called and some neighbors who wanted to bring us food this weekend, but this happened over a month ago. The video has been out a couple of weeks, so interesting timing considering Secretary Kennedy's press conference last week about autism. But we'll talk about all that in the future. We need to dive into the real reason for the show today and the reason I've asked our guest to join us today.
Are you ready to take control of your health together? You're not alone. Dr. Ben, as well as a mission-driven team here at Veritoss, created this online wellness membership because so many are suffering. We want to help more people by sharing the truth that we believe will change lives. Veritoss Wellness Membership is more than just a wellness program. It's a movement designed to empower you with truth, practical tools, and a support community at a price that's accessible for everyone. One membership covering your entire household. Upon signing up, you gain access to life-changing educational resources, expert-led webinars, live movement classes and exercise series, community groups and wellness initiatives, interactive classes, as well as exclusive discounts on supplements and advanced lab testing. We also offer complimentary, unlimited peace consults, a space for you to go deeper, discover who you were created to be, and explore how stress contributes to disease. We believe in getting to the root cause and understanding why what we believe truly matters. Our team of wellness navigators are here to guide you every step of the way. So whether you're just starting your wellness journey or ready to go deeper, there's something here for you. So jump in today. We can't wait to walk this journey with you. Visit VeritossWellnessMember.com to get started.
And lastly, that brings me to this next subject of there's this conversation I think we should be having, and we're going to have part of it today with our guest. But this whole measles outbreak, here's how I'm seeing it. There's three parts that we should be talking about: prevention, treatment, and hesitancy. Hesitancy on the part of some patients or people, general public, to participate in the first option, prevention. hesitancy on the part of healthcare practitioners to engage in the second part, treatment. It's really bizarre that it seems, I would call it bizarre, that we wouldn't talk a whole lot more about treatment and also really get inquisitive and curious about hesitancy from the individuals. So that's all I'm trying to do is have this conversation on all three parts of this conversation. Now, I know a lot of people are calling me different names that aren't super uplifting. But I just want to say to the local, in particular, the local institutions, there's a tremendous opportunity, is how I see this, in Lubbock, Texas, for healthcare providers, leadership, medical school leadership, a tremendous opportunity to have this conversation and to lead the nation back together in healing over this whole, our healthcare system obviously is in a mess. And the public, his trust in the healthcare system has demolished. Just in the last week or so, 2 weeks, a patient reached out to us, not our patient, just someone inquiring if they could be a patient, a breast lump for 2 years. She's been scared to go to her doctor. Vaginal bleeding for a few years, scared to go to her doctor. Someone this week thinks she had a mild heart attack last week and didn't go to the hospital and isn't going to go to the hospital, is refusing. It's the most crazy. And we know these polls that have come out, trust in doctors have dropped from 70 to 40 and lower now, I think. It's a real problem. And what I'm submitting for people to consider is that if we start with transparency and open, honest discussion, hear both sides of this story, come with a motivation of our kids' health at the center of this is where what should be motivating us, and be willing to let go of some viewpoints that we thought were right. It was Mark Twain that said I'm probably butchering this quote. I think he said, it's not what you don't know that'll get you in trouble. It's what you know for sure that just ain't so. And to have some humbleness and some confession, honest confession, truth telling. And I'm sorry, and I didn't see that, and I saw that wrong. I should have dug deeper. I should have not just gone with what maybe CDC and FDA institutional authorities were saying. I should have taken responsibility to jump into the literature myself and dig a little deeper. There's so many ways we can go, but it starts with this open, honest, transparent willingness, humbleness to just go wherever the truth may lead. And, I've been interviewing a few different physicians who have, I believe my judgment is they've followed that path in their career. They love their patients. They love the truth, and they're really good at listening, and they're good at being open and curious and digging for the benefit of the patient. The unique individual sitting in front of you right now, I'll talk to the practitioners. That's your responsibility, the person in front of you, and what are their beliefs? And what are their individual risk and benefit profile on this particular medical procedure you might be offering outside of vaccines, any medical procedure. The individuality in medicine has been replaced by protocol, one size fits all. And so we have an opportunity to just talk about all this and rise to a better place, because we are the worst place team. I talk about it all the time. We're in dead last place in all the health outcomes, but particularly with our children. The highest infant mortality rate, the highest childhood disease rate. We're taking all these medicines more than any other country, going to the doctor the most, spending the most money to get the worst outcomes. And just that fact right there should cause, I would think, authorities, policymakers, and physicians to take a time out and pause and step back and say, let me consider some alternatives, quote unquote, an alternative to this system that's producing the worst outcome. So I've asked Dr. Paul Thomas to come on the show today to share his story, his life story, with the goal of hopefully an aha moment, another light bulb going off for the audience of, wow, there's things we didn't see clearly, but let's keep seeking the truth and wherever it may lead. So Dr. Paul Thomas is an amazing physician. I've never had the opportunity to talk to him, but so glad he said yes to come on the show today. He's got some amazing websites, books. He's had an amazing career and journey, and we're going to hear all about it today. Dr. Paul Thomas, welcome to the show. Thank you for joining us today.
Thank you, Dr. Ben, and what a powerful introduction. I agree 100% with everything you shared. It's time for transparency. It's time. I was on a hike just yesterday, and I was pondering this question. Why is it that our peers, pediatricians, other physicians, and also so many parents out there, they are unable to even look at the information that we are sitting on? It's like blinders, and I just want to believe that vaccines are safe and effective. End of story. I'm not going to look. And it occurred to me, it's too difficult for them in their analysis. If you're a physician, a pediatrician, and your income largely depends on vaccines to a very significant extent, if you look and if you discover that what people like I and many others are saying, that there's real dangers here, we need to look at benefits, but we also need to look at risks. We need to look at whether they were properly safety tested. If they were to look and discover, as I ended up discovering, oh my word, they've never been properly safety tested, they're causing a tremendous amount of harm, and we'll go into this in a bit, then they would be forced to rethink everything about what they've believed in. And they just disconnect. I can't go there. I remember handing my partners, I used to be in a group practice with 4 other pediatricians, and I would hand them books that had all this information with hundreds of peer-reviewed references, and they wouldn't even look at them. They wouldn't comment, or if they looked at them in private, they sure weren't willing to acknowledge that they had looked at them. Right. And I think parents are in a similar boat in some cases. They've also been inundated with these messages of safe and effective, which is just a marketing slogan. And all their friends, if you're in certain circles, are vaccinating and under the same belief. And I'll just be clear here, since I mentioned vaccines right off the get-go, it's not just vaccines that are harming our children. Yep. It's a host of issues, but we'll get into it. Vaccines is a big piece of the puzzle, and we need to look at it. We need to be transparent about the data. And there are a lot of large institutions, large health plans, the CDC for sure, probably the NIH, the government data. They're sitting on the data that has the clues, or not just clues, they have the actual data that would answer the question. No. So anyway, I want to thank you for that. And if you're watching and you're still unsure about this whole vaccine thing, because you get such distorted messaging from the legacy media. I mean, it truly, it's propaganda. I'm sorry.
I've come to that exact conclusion, which I kind of knew that, but this measles, the last 5-6 weeks, the amount of media that have contacted us, and I started to do a few interviews, and then clearly I saw, whoa, they're not interested at all in the truth.
Right.
Absolute propaganda. So then I started sending a form, or my staff, a form response, email response. If you're willing to talk about the 3 parts of this conversation, prevention, treatment, and hesitancy, my doors are open. Let's sit down and talk on the record on all of it. Shut it down. Nobody will
talk to you.
No, absolutely not. And what you mentioned about fear, we just had a conversation. A friend of mine was in here. When fear enters, so these doctors, they get fearful of provision. Where's my provision coming from? Fearful of what will people think about me? I don't want to be labeled a name. Mm-hmm. Fear of they're losing their job. All this fear. Fear. So I'm going to shut it out. Tunnel vision. It's awful. So,
it's safe, right? If I follow protocols, then the medical board won't come after me. I don't have to worry about my income stream. I mean, it's secure.
Yeah.
But who suffers? The patient.
Exactly. And doctors have been trained since we were in 1st grade. We're told, make all A's, follow the rules. Make all A's, follow the rules. And we have all through elementary school, all through junior high, all through high school, all through college. You got to make the best, get into the best med school and residency and the competitive. And we're told, we're trained. It's a psychological thing. So all of a sudden, whoa, get outside those lines. No way. That's scary, super scary. But you're right. If you keep the patient first, and what's best for the patient. So let's maybe just go right back to your first grade, or wherever you want to go back in your story.
Okay.
Promise of why'd you get into medicine? Where are you from? How'd you get to where you are now?
Yeah. Well, let me tell you about first grade. I was born in Portland, Oregon, but my parents were missionaries with the United Methodist Church. And right before first grade, they moved to Rhodesia, which is now Zimbabwe. And at that point, we were living in a village for several years, immersed in the Shona language and the culture. And I went to a school where everybody spoke Shona, no English. I became very fluent. I actually was dreaming in Shona. It was almost like it was my first language, even though I learned English first. I then, fast forward, I finished high school in Swaziland. My entire youth through high school was in Africa. So Rhodesia, Swaziland, and a little bit in Zambia. When my parents were kicked out of Rhodesia, they moved to Zambia. They were kicked out of Rhodesia, by the way, for standing up for the rights of the population. And so I was a part of that movement. Sort of the civil rights movement that was happening in the U.S. was happening also in Rhodesia. A Rhodesia system was sort of apartheid-like, and we were standing up against that. Very few whites stood up against it because it was very convenient. If you were white, you were very privileged under that system. So our family ended up getting booted out of the country by the white government because of numerous things we were doing to support the movement, not fighting, but just educating.
Yeah.
So that's, in that sense, it was in my upbringing. It was in my DNA almost to stand up for the person who has no voice, to always seek the truth and to always ask questions. Why? If you're seeing something that doesn't make sense, what's really going on here? So then I got into the system, pre-med, medical school, residency, board certified pediatrician. I was teaching residents and medical students for a few years when I got out of training. I mean, I was at the top of my game, if you will, in my career, right, as a pediatrician. And I then, due to an enormous amount of debt, I realized I had to get into private practice to survive. So I did, joined a group of pediatricians, and I did that for 13 years with group practice. And it was during that period, in 2004, 5, 6, and 7, in my own practice, I had a patient population of about 3,000. I was very busy. I was getting about 30 newborns a month. My peers were getting about 2 to 4 newborns a month. So I was seeing a lot of babies, growing a big practice very quickly. So I think because of that volume, and I was following the CDC schedule at that time in the early 2000s, I ended up having a severely autistic kid who had been completely normal at age 1. One of them was completely normal at 18 months and regressed into, severe nonverbal, horribly severe autism. These kids were in pain, abdominal pain. They couldn't make eye contact. They couldn't communicate. It was like, first time you see that, it's like, oh, that's what autism is. Because here's the thing, Ben. When I was in Africa, I never saw autism, not one case. In medical school, I went to Dartmouth. Dartmouth served the whole Northeast from northern Massachusetts all the way up Maine, Vermont, New Hampshire. So we had a massive pool of patients. Never saw a single case of autism. In residency, I was in Fresno, so the San Joaquin Valley, huge population we were serving. Not a single case of severe. There were a couple cases of PDD-NOS, which was the old term we had that would equate to autism spectrum disorder, but never one of these severe cases kids who would require lifelong care, kids who could not function without 24/7 supervision. So by the time I got to the 4th case, and I'd already been doing a deep dive into the literature, going to conferences, alternative conferences that were powerful because the information's there, Ben. I know you've done some of this research. Yeah. As you said in the opening statements, if doctors would just open their minds and look at what we have already, there's plenty of information to realize that, okay, we have a very toxic world we're living in. Some people have genetic vulnerabilities, so they're more likely to be harmed by those toxins. And you can argue about which toxins are the worst, right? So there's a professor at Duke who really believes it's acetaminophen. There's a professor who is at Arizona State who really believes it's aspartame. There's Dr. Seneff who believes it's glyphosate. Yeah. And then you've got a handful of us who've done the research who now are aware that a huge contributor to the problems our children are having is the vaccines. The schedule has just blossomed since the 1986 Childhood Immunization Act that removed all liability from anybody involved with giving vaccines. The pharmaceuticals have no liability, the companies that make these products, so there's no incentive for them to make them right? I mean, as long as they're making profit, they're in the business of making profit. Doctors, nurses, anybody who administers vaccines, we don't have to worry about liability. I think that's a big problem because there's no checks and balances in that system. So as we saw the vaccine schedule expand, we also saw the expansion of not just autism, but a host of problems. So I was in private practice with my partners there, the 4 other pediatricians, 5 of us. And in November of 2007, I walked into what was supposed to be a 2-year visit. And I will never forget that day. It was like the last straw for me. This little guy, I call him Jack, that's not his real name, but he was in a little push stroller and facing me with his back to the window. And I walk in the door and he's just doing this. And I can always get a kid to engage. So I'm like, hey, Jack, what's going on? Could not get him to engage. There was just like lights out. And I was pretty concerned that was my 4th case of autism. And it turned out to be, yes, indeed, nonverbal. He had regressed. I looked through the notes. I had seen him at 1, but not at 18 months. One of my nurse practitioners saw him at 18 months. And everything was normal, even at 18 months. So it was like, okay, I can't do business as usual. I went to my partners, and at that point, I was already crystal clear that the hepatitis B vaccine was the most ridiculous thing that ever happened, in that we used to give it to teenagers. Okay, I mean, I don't even think teenagers need it, honestly, unless you're in a high-risk category of risky behaviors, which is sex and drug abuse. But it certainly made no sense to give it to infants whose mothers were known to be hepatitis B negative. So that vaccine has a huge dose of aluminum, 250 micrograms. There used to be a document. It's really hard to find. They've buried it now. I can't find it. But I had it for a while from the FDA from 2001 that said not to exceed 3 to 5 micrograms per kilogram per day of aluminum in a parenteral application. They had found, looking at preemies in the ICU who are getting TPN, parenteral nutrition, so they're so immature they can't eat, so they feed them through their veins. They've proved that for every day they were on this IV solution food, TPN, they lost scores in developmental scores. And they were able to attribute it to the amount of aluminum contamination that was in those fluids. Hence came that recommendation. Well, parenteral means you're not giving it into the intestines. You're getting it through a shot or an IV. Vaccinations were just sort of ignored, the fact that we are injecting so much aluminum. And there's so much more in vaccines than just aluminum that's harmful. But that was just, my aha was like, this is insanity. So I went to my partners and I said, I can no longer support the CDC schedule. The Hep B shot makes 0 sense. OBGYNs are testing every mom in my practice. I mean, literally every mom. I would walk in to see that newborn and I could look at the chart and they were Hep B negative. There was no reason at all to give that shot that early. Not only is it toxic and completely unnecessary, but it's also doesn't make sense immunologically. Kids who get the shot that early won't have protection when they're 17, 18, 19, in their 20s, because that immunity at most lasts about 10 years. And there's plenty of studies that show that. So that was sort of the beginning of my journey of, I basically was told it's unethical not to follow the CDC schedule, and I was shown the door. Mm-hmm. So I left with about 1,000 patients, started my own practice, integrative pediatrics, and we grew from that 1,000 who followed me to about 15,000 over just a few years.
Wow.
And we had a waiting list for years that we couldn't even get to because the demand was so high. In Portland, Oregon, where I was practicing, we were the only mainstream practice that took insurance that would really allow parents to do whatever they wanted once they were informed. So we practiced true informed consent. There are risks. Instead of just saying, oh, it's 1 in a million, that there's a problem, do them all according to the CDC, because that's just not the truth. The truth is vaccines, it turns out, have quite significant side effects or effects, but there are real risks. So what ended up happening, I looked at my data 7 years in 2015, and I tried to publish a study, and I submitted it to a journal that had previously published a study that used the same parameters. Liz Mumford had published it, and they wouldn't take it. And I'm realizing I don't have the clout to get this through. I'm this crazy busy pediatrician, just seeing patients, clinician, not really a researcher per se. So I wrote a book, The Vaccine Friendly Plan, so I could put that data in there. And in the back of that book is the data for the 3 groups of patients that I was looking at. One was unvaccinated. At that point, I only had 233 unvaxxed. The other group was vaccine friendly plan is what I was calling it. It's partially vaccinated. And then the third group was basically CDC vaccinated, following the CDC schedule. What I found in that data was no autism in the unvaxxed. We had 3 cases out of a little over 1,000 in the partially vaxxed who developed autism, but it went away by the time we collected the data. So we actually did a chart review of every single patient in the practice at that time. And the explanation for how that could happen, because people say, oh no, autism is lifelong. No, it is not necessarily. For some unfortunate children, it is. But part of the vaccine friendly plan approach was if you see any developmental delays, you stop vaccinating. You don't just keep going. You stop vaccinating, you try to figure out what's going on, and there are a host of things we would do to support the immune system, try to detox, and try to allow that child's body to heal. And in those 3 cases for that group, it worked. So they lost their diagnosis. And then in the most vaccinated CDC, basically, we had a rate at that time of 1 in 60, which was pretty much the going rate in the States in 2015. The autism rate has gone from, basically non-existent before 1940. I mean, there's a few case reports apparently, but we never saw it. And then it just blossomed to the 70s. It was 1 in 10,000. We just got a report. I'm sure you saw it a couple days ago from the CDC. It was 1 in 36 2 years ago. Now it's 1 in 31 in the US. 1 in 12 boys in California are diagnosed autism by age 4. That is horrifying. This is an emergency of untold proportions. We're destroying this generation of children. We've got to figure out why. And I'm so glad RFK Jr. has made that a priority. I know he's getting a lot of heat from the mainstream folks who want to keep their head in the sand like an ostrich and not look. We've got to look. We've got to figure it out. Let's follow the data. I was trying to get data because I was trying to figure it out. Remember, I'm one of those inquisitive guys, like, why is this happening? And I was pretty sure vaccines had something to do with it, but I wanted more data. Well, you've got to have data. You can't just go with your gut feeling when you're trying to be scientific. Yeah. So I couldn't get that paper published. I published the vaccine friendly plan, and then fast forward a couple, 2-3 years, the medical board started coming after me in Oregon for my license. And I mean, they were relentless. In 2019, February, I remember opening this letter and they said, prove that the vaccine friendly plan is as safe as the CDC schedule. I remember just laughing and going, this is one, I was getting letters almost weekly. This one right was like, wow. The CDC puts new vaccines on the schedule almost every year. They never prove that this schedule is better than the last schedule, for just as an example. But thankfully, some smart person, I've forgotten who told me this, but said, Paul, just do a QA analysis. You don't have to go through the lengths of creating an IRB, because I've done that. I did an IRB for my 2015 data. But you can do a quality analysis to see if changes that are happening in your practice are making a difference, positive or negative. So I did that, and I hired an outside expert to pull every single chart and data point on every patient born into my practice. So not the siblings of the patients who were born into my practice, because what was happening in Portland, Oregon, and up until the time of my retirement in 2022, for about 10 years before that, there was this shift in the American Academy of Pediatrics from it's unethical to discharge patients if they don't have a place to go for equivalent care, to, oh, it's ethical to discharge patients who won't vaccinate. And so, wow, you put that permission, if you will, from the Academy of Pediatrics, who, pediatricians, that's your organization, and they're saying this is the right thing to do. Kick them out if they're not going to vaccinate. And they had bogus reasons for it. Well, those unvaxxed patients are going to get the cancer patients sick. They're going to get the immunocompromised sick. When I get into my data, I'll show that was the opposite is true. It is the unvaxxed who hardly ever get sick. When they do get sick, they get better very quickly. So who's going to get somebody who's immunocompromised sick? A sick vaccinated patient, not a well unvaccinated patient. Anyway, they asked me to get this data. So we pulled the data for everybody born into my practice. And that was the study I published in the International Journal of Public Health with Jack Lansweiler. That was, I call it my vaxxed unvaxxed study. And what we found was mind-boggling. For the unvaxxed, and at this point I had over 560 unvaccinated patients who were born into my practice. I probably had over 1,000 in my practice, but those were the ones we were looking at. So we were really comparing apples to apples. And we had 2,700 and some variably vaccinated, which was basically vaccine-friendly plan. When people look at that data, if you've ever seen it, and you see the orange curve for the vaccinated going up, 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 up over the 10 years of that data, and the blue curve very flat and going up only a little bit for the unvaccinated, you realize that there's 2 to 5 times as much everything in the variably vaccinated. It would have been even worse if you were looking at CDC vaccinated. So what things were associated with being vaccinated? It was all the allergy things: asthma, eczema, allergies, allergic rhinitis. It was developmental issues, developmental delays, learning disabilities, ADD, ADHD, autism. I don't have a graph of autism. The numbers were too small, but there was a link with vaccines and autism. And then here's the real, like, the unvaxxed rarely got sick, and when they did, they got well quickly, which meant that vaccinating actually creates more infectious diseases. So our vaccinated population had way more ear infections, sinus infections, lung infections, GI infections, skin infections, infections of all type. Whoa. That should be like a wake-up call to somebody who's thinking, well, I'm going to vaccinate so my kid doesn't get sick. I'm going to vaccinate to protect my child. Or even if you have the thought you're protecting others, which most of the vaccines don't protect others, but you're actually going to have a sicker child who's going to put others in greater danger. We know why. The vaccines shift the immune system towards allergy and autoimmunity, and away from the innate natural immune system, which is your first line of defense for infections. So the unvaccinated have a robust innate immune system, and they do very well. When COVID hit, I was in practice. I didn't retire till December 2022. We didn't have a single child have a major problem with COVID. Not one ended up hospitalized for COVID, other than one of the teenagers, when they allowed it, ended up getting the COVID jab and got myocarditis and ended up in the hospital. But healthy kids, it was no big deal. So retrospectively, we now know that the great mistake was, quarantining people, keeping people out of the schools, masking them. We should have let the kids just get it, almost like chickenpox parties in the old days. And those kids would have all had natural immunity that was long-lasting and would have been protecting the real vulnerable, which were the elderly and the severely immunocompromised. So I took all that data. I've written a new book called Vax Facts. To me, it's what you need. It's Vax Facts, what you need to know before you choose to vaccinate. And in this book, at all ages and stages, by the way, we have a chapter for adults, because I realized my own mom was in a retirement home, and I could not convince her not to take the COVID shots. And she raised me to question authority, to deep dive into it. And, but she said, well, Paul, how can you be right and all the other doctors are wrong? Because she's listening to the news and hearing, these talking head doctors on legacy media spouting off the narrative, right? And unfortunately, she got the shot. I think she got 3 of them, and I think the last one took her out. She ended up having pulmonary fibrosis and couldn't breathe. But that's the challenge, right? So many people are listening to garbage. I mean, when I watched the news when COVID was rolling out, it was so horrifically distorted. I wrote a book that's not worth buying now because it's so dated. And I had a friend hospitalized in Oregon. He was one of the first people in the pandemic. He was hospitalized in March of 2000. And I got a book out within a month to deal with the issues because he almost died in the hospital with the hospital protocols. And so many people did die from those protocols because of mismanagement, which you've faced actually with the MMR, or not the MMR, but with how measles has been handled there in Texas where you work. You're one of my heroes, by the way, for how you handled this and the ethics and the courage, because it takes courage. There is a risk to one's career when you do what's right, but it's not what the establishment wants.
Yeah, that's for sure. I knew that, but I know it really well now. But you certainly do. I mean, with the medical board letters coming left and right, and you have to spend valuable time away from the kids who you're trying to help and take care of as a physician and dealing with
enormous amount of time. They were after me for over 4 years. 3 sets of attorneys trying to help me. Here's the interesting thing: when we published that data, that was probably the most powerful real world data. It's not a compilation of data that's out in the ethos or whatever. This was real world my practice, and it doesn't get any clearer than that. A few days after that was published, I got a call from my attorney, and he said, "You cannot go into the office. You cannot call any patients." I got a call from the attorney for the medical board, and your license has been emergently suspended. You are a threat to public health, is what they're saying. So suddenly I had to leave my practice. Now, when you lose your license and you have insurance contracts, those go away. You can't have an insurance contract if you're not licensed, and you can't get them back. I mean, it's just the way it is. So that practice that had over 15,000 active patients dwindled over the subsequent few years to about 7,000. At that point, I realized the whole thing's going to shut down and collapse. I wasn't making any money. It was no longer a viable business. So thankfully, I had nurse practitioners, a couple of them, who stepped up and said, "Well, we'll keep it going." So I sold it to them. I think, I don't know, time will tell, but I think it was pretty much a wash on my side. It was definitely just about a wash on income, because there's so many expenses I hadn't anticipated in winding down a practice. But thankfully, they are continuing the good work, providing care to anybody in the greater Portland area and honoring informed consent. They still vaccinate if that's what people want to do, but they also honor those who don't want to. And for those of you listening, depending on your state, most states allow at least a philosophical or religious exemption. And if you're in one of those states, the schools will tell you have to vaccinate or your kid gets kicked out, but it's not so. You can exercise your legal right in that state to those exemptions. So make sure you study that. NIVC, National Vaccine Information Center .org keeps up to date on which states have what policies on those vaccines. So that's really important to know. I think so many families who would rather wait, aren't sure about it. They're trying to get more information, get bullied into vaccinating, when this is something we need to look at.
Yeah, for sure.
Yeah.
So guys, I just want to summarize real quick. Basically, Dr. Thomas is saying he had this huge practice. A portion of his practice decided to follow CDC schedule. A portion decided to customize it. Say yes to this one, no to that one, maybe delay, maybe not, put them all together, space them out, stuff like that. And then a portion of his practice said 0, I don't want any.
Correct.
He goes back and pulls all the data to see who's healthier, who has the most sickness, illness, different and that's what he was talking about, these graphs. And thank you for those graphs. I've used them in presentations. But ear infections, ADD, all the things he went through, substantially greater And this was just mostly the partially vaxxed, right?
Correct.
Not
There
even,
was nobody fully vaxxed in that group.
yeah. So imagine with the fully vaxxed, what those graphs would look like.
Right.
So this is just pure real world data from a pediatrician who's just trying to seek the truth. And within 2 or 3 days, he's having his license is suspended. I mean, it's just.
So
Oh,
I have to give you a little anecdote. I ended up getting it back 6 months later because they had failed to file charges. So they yanked my license, but never filed charges. And so that's illegal. So my attorney had at least something to go to them with. They would not just give it back to me as it was. They had stipulations, and my attorney said they are absolutely not going to give on these stipulations. And a couple of the stipulations are pretty telling onto what they were worried about. One was I was not allowed to do research on using patient data. So that data that I had was so powerful, and they knew it. They didn't want any more research coming out of that data.
Mm.
The second thing was I wasn't allowed to talk to anybody, patients or staff, about vaccines. Therefore, I wasn't allowed to do well child visits, which is about 50% of what pediatricians do. In that world I was in, I felt like the well child visits for me was the best opportunity to educate, because I mean, that's really what a well child is all about. I mean, yes, you make sure the kid's healthy and growing and developing, but that takes 5 minutes. The rest of the time is you should be educating on how to raise a healthy child, which should be, getting good nutrition, avoiding toxins. And one of the big sources of toxins is the vaccine. So that needed to be discussed along with the pros and the cons of each vaccines for each disease. I would basically walk into these visits and talk. Well, I'm not talking them out of it. I'm informing them, and then they're making a decision not to vaccinate. Bad business move. I mean, I would walk out of this office just smiling because I was happy the kids were going to be safe, but just thinking, yeah, I spent extra time and I just lost $220 in that room. Medicine is a business. And I think unless you have, clear ethics and a clear understanding that you really got to put your patient first, regardless of what that does to your income. They've incentivized financially the administration of vaccines to such a great extent. I don't know if you've experienced this, but we get paid multiple ways. So a big practice, and I had a fairly big practice. At one point we had 10 providers and 30 some employees. I mean, we were a screaming busy business, and we would buy wholesale vaccines for the clinic, and you mark them up a little bit. You get as much as you can out of insurance, because that's what you don't want to leave money on the table with insurance companies. That's just bad business. So you get some money on the markup on vaccines. That's not a huge amount, but it's not negligible either. It's probably, in my practice where we were billing out at the peak, $3 million a year, $500,000 could be markup. Mm-hmm. Then there's a huge source of income called the admin fee. So most insurances will pay you an admin fee, which is basically a thank you for giving this vaccine. What they say it's for is all the education you're giving, right? Which, if you truly were sitting down and giving the right amount of education, that admin fee would be inadequate because it's very time consuming to go through all these vaccines, pros and cons and all of that. But what almost every pediatrician does is there's a document from the CDC called a VIS, Vaccine Information Sheet. And we have them all laminated. We walk in, we hand them to the patient. Hey, take a look at this. This will give you the information about the vaccines we're doing today. And that VIS is so one-sided, it's ridiculous. On one side is all the threats of that infection, whether it's tetanus, diphtheria, pertussis, diseases that the kids are never going to get. But this is what could happen to you. And the flip side is saying basically serious side effects are 1 in a million, which is not true. So you're misinforming the patients and getting a cha-ching bonus. And it's a significant bonus. It's about $40 for the first antigen and $20 for each subsequent antigen. So basically, taking a kid through the first year of life is going to make you well over $1,000. And so and then you keep vaccinating through their whole life. It ended up in my practice, I was losing over $1 million just on admin fees.
Wow.
So $500,000 up to $500,000 on the markup. I think it was a little less than that. But definitely over $1 million on the markup on the admin fees. And that's not all. They have quality bonuses for being a good doctor. You get a bonus. And in pediatrics, one of the quality measures was how well you vaccinate. They love to, and this is insurance company by insurance company, so it's different, but enough of the big ones are doing this so that if I had my 2-year-olds fully vaccinated, there's an extra financial bonus, and it's pretty significant. And add to that another thing. These quality measures are also used to determine whether you're going to stay on the health insurance plan. So remember your GPA when you're in college or high school, and let's say you get all A's and an F. Your GPA doesn't look that good. You're an average person. That one bad score really hurts you. You don't look like a good student. Well, and I did have supreme measures on avoiding hospitalizations, taking care of my patients out of the hospital, minimal use of tests and labs and x-rays and ancillary subspecialists, because I was taking really good care of my patients, and I had great health outcomes, but I had the worst vaccine record of anybody in Portland, Oregon. So I got an F on that one score, and it was enough to cause me to lose a couple insurance plans. So there's a disincentive right there. And then there's one other way pediatricians make money. If you reach a certain threshold for what they want in vaccines, you get another little bonus on everything you do in the office. You know, those billing codes that we have, whether it was an ear infection or a well child visit or whatever, there's another little incentive. Thank you for being such a good doctor. We're going to give you a bonus. It really has come to the point where if you want to take insurance, which that's what most doctors do, you have to vaccinate pretty close to the CDC schedule, or the numbers don't work out. Your business will fail.
Yeah, and we attract a lot of those kids. They get fired from their pediatrician. I just had I was giving a presentation in another city, and had an audience member come up and tell me, she was a grandmother. She told me her daughter took her baby in for her routine well child. At the 4-month visit, had a bad reaction to the vaccinations. At the 6-month visit, had another bad reaction. And then at the subsequent, regressed into autism. And the mom decided, I'm not going to vaccinate anymore. And the pediatrician fired her for that.
Yeah.
And that's
Dr. Ben, I heard that story over 300 times over the last 10 years in my practice. When they started kicking patients out, these patients had nowhere else to go but my office, basically, unless they could pay cash. There was a couple other small practices just doing cash. So you sit across from a family, and usually it was both parents, and a severely autistic kid who's nonverbal and is just like all varieties of distress, spinning, screeching, darting, or sitting in the corner. It's just horrendous distress. And they're bawling their eyes out, sharing the story of what happened to their child. And in many cases, it was right after the vaccine. I mean, that day. Often it's not. It takes time. A lot of this is autoimmune. Autoimmune conditions take months, sometimes years to develop. Yeah. But what they saw was the same. They lost the kid that they had who had been normal. And I mean, they're just bawling their eyes out because they wish they had known. They knew what caused it. So you'll hear detractors will say, well, association doesn't mean causation. That's true. There's more cars on the road or whatever, and that doesn't mean more cars on the roads caused autism. But association could mean causation. I mean, if you inject too much aluminum, if you drink too much glyphosate with all your pesticides and stuff on your food, if you over-vaccinate and you just get this massive load, not just load of toxins, but over-stimulate the immune system, immune activation. We know these are the mechanisms that cause the problem of encephalopathy, of brain issues, et cetera. So how do you go from association to causation? Well, we need enough data And I believe we now have it, and RFK is going to get more, I'm pretty sure. The data's there already to show that this is more than association, because we have multiple studies showing the same thing. The more you vaccinate, the more you see these problems. And you need to have a mechanism that makes sense. And we have that. We know there's direct toxicity. We know there's immune activation. We know there's autoimmunity that then triggers your immune system goes up against your brain, causing massive inflammation. So it's pretty clear, those of us who are looking at the data, that we got to do it different. As you opened it up, we are, spending more money on healthcare. We have the worst child mortality of the developed nations. It's a disaster. And this autism thing, it's unfortunate, because maybe it's unfortunate we use the word autism, because autism is so diverse.
Yeah.
But just as I found very clear connections between vaccines and developmental delays, speech delays, ADD, ADHD, autism also, this level of toxicity that the dose makes the poison, right? And I just think the dose of vaccines, both in the toxins within them and the immune activation by giving so many so soon, so young, it's just exceeded the body's ability to handle that and cope with it. So we're tipping these kids over into a really sad state.
Yeah. Well, do you feel like, because there is so much data, I mean, I think there's 7 studies now just looking at vax versus unvaxxed.
Right.
Beyond that observation, it is so much research that has shown, well, how does aluminum in the muscle activate a macrophage and end up in the brain and affect the brain neuroinflammation? Well, all those mechanistic, the physiology has been worked out. There's so much research. I had someone just email me the other day. 200 different studies was the title of the email. 200 different studies linking autism and vaccines. I've only gotten through like 5 of them. But I mean, the point is there's just so much there. But again, really the media, the health authorities just continue to parrot. And that's why at the beginning, because I think we're there, and by September, according to RFK, trying to kind of give an out, like, guys, I mean, this is getting to the point of it's irrefutable, I would say. That's a strong word. But the people are seeing it. The people are seeing it. They're going to see it. They're going to keep digging. It's their kids.
Yeah.
And it's going to be the last man standing. It's going to be the academic, leader of some institutional, government agency. These guys are just getting more and more isolated to where there's no one left. It's the medical board and the heads of these institutions. And like, come on, guys.
Yeah. Well, we learned from COVID, which, that was the most bizarre thing ever. And I'm so sorry that so many people have been injured and killed by that shot. It's not a vaccine. It doesn't improve immunity. It actually makes you more likely to get COVID. It never should have been rolled out. There's been so many very brilliant doctors calling for that it needs to be taken off the market. I just interviewed Dr. Peter McCullough this week, and he's super strong on that. We don't need any more data. They need to pull that off the market, period. But I think that was enough. People have seen harm, and the harm is continuing, by the way, because the spike seems to be lasting a very long time, which I think was by design. I mean, this was a manufactured virus that, they gave it the ability to get into your body and stay there using the mRNA platform and have your body make the toxin, the spike protein. Ingenious if you want to keep people sick, or if you want to really give them a long leash and benefit of the doubt, they thought maybe that, well, if the body can make the spike, then you'll keep your immunity up. But if you read enough, you realize that it was misguided, but probably even worse than that.
Yeah. Well, we've got about 10 minutes left, Dr. Thomas, which I know people need to get the book Facts for sure. And I do want to talk about your other websites too, but because I'm assuming, as you started seeing these correlations, these autistic kids, these 4 kids initially, and then you pulled all that data, but actually looking at individual vaccines and risk and benefit, like tetanus. What's the risk of that shot? What's the risk of the getting tetanus, and how often do kids get that? And just all that detail on individually on each shot to make that informed decision where you may want to take 1 or 2 or 3 or whatever.
Right.
So talk a little bit about that and where can people find that kind of stuff, and how can you be a resource? You can spend, the next 10 minutes or so talking about that.
Perfect. Very good question. I mean, parents who are trying to navigate this decision, should I vaccinate or not? I would encourage you to get VaxFacts, because I covered what I'm about to cover real quick, because I'm going to do it fast. It's a lot of information. But you need the pros and the cons, and you need to understand how much that disease is around. If it's gone, you don't need to vaccinate. I mean, you can always vaccinate later if the disease comes back. Most of these diseases are gone. Effectively, they're not a threat. So let's start with pregnancy. I've just got to tell you, there's a chapter on pregnancy. We didn't vaccinate pregnant women until I think the 70s, maybe, when they added the DTaP, so the tetanus, diphtheria, pertussis. Misguided, the thought was pertussis was killing infants, not many, but a few every year. And if you vaccinated all the moms, then they would share some immunity against pertussis. Theoretically, it sounded great. It has failed. That vaccine triggers miscarriage, prematurity, toxicity. It's a aluminum-containing vaccine, and it's actually not protecting kids. I mean, it might give them brief protection, but in the end, the more you vaccinate against pertussis, the more likely you are to get pertussis. Same story that we had with COVID. So that was a failure. Then they've added the flu shot, huge trigger of miscarriage and premature labor. Studies on that. Then most recently, they added the COVID, unthinkably, ridiculously stupid, and now RSV. So if you're pregnant, thinking about getting pregnant, please stay away from vaccines. If you have that maternal instinct, your gut instinct, if you will, your intuition, when you're carrying a baby in your womb, there's this generational wisdom, I think, that women have, that you're there to protect. You watch what you eat. You watch what drugs, if any, you take into your system. You avoid toxins at all costs. Why would you inject direct toxins into your body? So number one, that chapter, please. I mean, I said it in my vaccine-friendly plan book as well. No vaccines while you're pregnant. Newborn, you're going to walk into the hospital. When you sign in to have your baby, you are inadvertently, unknowingly giving permission for them to do the vitamin K and the hepatitis B shot. It's in the fine print. They'll use words like biologics and stuff like that. So you need to make it crystal clear that you don't want the Hep B if that's what you don't want. Now, I'm retired, not licensed. I don't give medical information. This is just information. I'm not diagnosing or treating. So just consider me as Professor Dr. Paul. But it makes zero sense to give a newborn a Hep B unless birth mom has Hep B. It's just crystal clear. Most thinking doctors can agree on that. The vitamin K, I prefer it be done orally, but if you have to do the shot, it's probably going to be okay. There's not a lot of data of harm from the vitamin K, but there is some. It does carry a black box warning not to inject it, or when you inject it, it could cause death. I never saw a case of death or harm that I was aware of from vitamin K, although there is some concern it might be triggering more jaundice. Anyway, definitely no Hep B if you think about it, and then wait on the vitamin K. Now, the next chapter in the book is about the vaccines for infancy, but I want to mention there's a chapter on SIDS. This is really important. SIDS is sudden infant death syndrome. And this is your baby was fine and you find them dead. So it's tragic and it's happening. There's 20,000 infant deaths in the US. We talked earlier about infant mortality. It's sky high. It's not all SIDS. Congenital malformations, genetic stuff is a good chunk of it. I think it was 7,000, something like that. They're only attributing a couple thousand a year to SIDS. And I know it's much more because there's 7,000 they're saying unknown. But bottom line is that the studies on SIDS that actually looked at when did SIDS happen relative to the vaccine? There's 6 of them published in the peer-reviewed literature. And 78% of those deaths happened in the first week after the vaccine. And just like with COVID, the most risky day is the day of the shots. So most of the babies are going to die day one. They got the shot, they die. The next most risky day is day 2, day 3, etc. You don't have SIDS happening the week before you get your next round of shots. So it couldn't be more clear that vaccines are killing babies. And vaccines are killing babies at a higher rate than all the diseases for which we have vaccines. So you got to think about that. In fact, I've got a appendix, page 303 in VaxFacts, that shows, and the very first printing, by the way, had an error. So if you don't find what I'm telling you, it's been fixed. But it shows that for every disease for which we have a vaccine, you're more likely to die from the vaccine than you are from the disease. That includes measles, by the way. And you've been, dealing with measles, and it's pretty clear now that the 2 deaths that are attributed to measles in your town actually didn't die from measles. And that's been covered extensively. And I know you've been a part of, getting to the bottom of this. Thank you for that. Measles is something I had as a child. I was born in 57, and everybody in my generation and earlier, we were immune for life. When they introduced the vaccine in the 60s, 1963, deaths in this country from measles were about 400 out of 200 million people plus. It was not a lot of death, but still, kids were dying. There's no question about it. That one's tough for a lot of people when there's an outbreak like there is. I'm scared. You don't need to be afraid of measles. We had a measles outbreak in the Portland, Oregon area, and I had probably one of the larger practices with unvaxxed patients. I had one patient I was aware of who got measles from that outbreak. They didn't come into the office, thankfully, and they all did fine. So if you're really trying to protect your child, don't forget the fact that vaccines can kill. And they also do all those other things that we talked about already that I found in my study. So at 2 months, it's one of the 2 months, 6 months visit, and the 4 months, they're horrific in how many different vaccines are being done at once, how much aluminum is contained relative to the weight of that baby. It's a toxic load. I mean, it's the DTaP, that's 3-in-1. Diphtheria, which is gone. There's no diphtheria in the States. Tetanus is basically gone. There hasn't been a childhood death from tetanus in 20 years in this country. And pertussis, the vaccine isn't working. The organism has mutated, shifted. It's protactin negative, the pertussis that's out there now, and the vaccinated can't fend that off very well. So pretty worthless. Hib used to cause meningitis, rarely epiglottitis. That was bad. I saw that when I was in training back in the early 80s. It's gone. There's almost no Hib disease. There is Haemophilus influenza, other types, but not type B. So you're vaccinating against a strain that's basically gone. And the vaccine does have side effects. This is the thing. All these vaccines have side effects. You can go to a package insert and look up serious adverse events. I'll give you an example. Prevnar is one of the shots they give at 2, 4, and 6 months. That's against pneumococcus. Pneumococcus is a bacteria. You've heard of strep throat. Well, this is a strep pneumococcus. It's a different strep. There are about 100 plus strains of strep pneumococcus. We came out with a Prevnar 7 in 1995. And when that was added to the schedule, I think that was part of the problem with the bump that we saw in autism rates, because it was an aluminum containing vaccine added to already, we had a Hep B and a Tdap that were available. 2001, they really pushed the Hep B on infants. So that's when it really got bad. But the Prevnar 7 only worked for a few years against those strains, and then the strains shifted. So then they went to Prevnar 13 in 2005. And for a few years, it was picking up a few more of those strains. Last year, they came out with Prevnar 20. Now, I had retired by the time it came out, so I thought, let's look at the data. So I pull out the package insert for the Prevnar 20, and I look for serious adverse events. First of all, like all vaccine studies, they did not test Prevnar 20 against saline, against a true placebo. They tested it against the Prevnar 13. So you've got, I can't remember if it was 20 or 40,000 who got Prevnar 13, 20 or 40,000 who got Prevnar 20. What was the rate of serious side effects? 5%, 1 in 20. This is not 1 in a million that you get on the Viz sheet. It's 1 in 20, and one of the serious side effects can be death. Who in their right mind would go take a 1 in 20 chance of a severe adverse event for a disease that's rarely causing serious problems? It's not never, but it's so rare that, okay, that's risk benefit, right? Some parents have to go through that mind thing of, okay, I couldn't live with myself if I didn't vaccinate for a disease for which they have a vaccine. What I would just ask you also, can you live with yourself if you give a vaccine and it harms your child? And that harm could include death. I say weigh the risks and the benefits equally and make a good decision, because your child depends on you. Parents, they can't make this decision. You have to make it. You have to do the work. Please don't just accept what's coming down in these protocols that, as you said at the beginning, Ben, they're one size fits all, and it's not good medicine. It's not good medicine at all. So anyway, I'm going to run out of time, but you can go through all of them that way and realize that most of the diseases aren't around. They're no longer deadly. And the vaccines, while in some cases, like in measles, they do provide benefit. I mean, the measles vaccine works, not perfectly. There's about 5% who don't get immunity from that first one if it's given early at 12 to 15 months. I used to give it at 3 years, and I got 99% immunity with just one shot, giving it at 3 years. But the risks, I sat across from those 300 plus families who got kicked out, and it was usually the MMR. It was the last straw for their kid. And, we've loaded these poor kids up with aluminum. The hepatitis B has aluminum. The Tdap has a lot of aluminum. The Hib, all but one brands, has aluminum. The Prevnar has aluminum. You're doing this at birth, 2 months, 4 months, 6 months, sometimes 9 months. Then you give 4 live viruses typically at 12 months, or some pediatricians wait till 15. Measles, mumps, rubella, and chickenpox in a system that's probably already poisoned with aluminum, and it's like pouring gas on a fire. It's trouble. That's my theory. It's the thing that makes the most sense to me as to why would the MMR be such a problem. There's 2 possibilities, actually, in my opinion, because we didn't see the MMR causing so much problems in the 60s. Very little autism back then. And autism isn't just vaccines. So let me be clear. It's all these other things. You got to do everything today, folks. You got to eat organic, get real clean food, clean water, avoid toxins. Don't use acetaminophen. Those are all important, but you got to look at the vaccine issue. It's probably the number one toxin that's out there that we are just overwhelming our kids' bodies. I rambled a bit. Sorry.
No, that's great. It's all about informed consent. It's about getting educated. It's supporting these parents who are trying to get educated in a culture of bombardment from legacy media and health authorities that appear to be uninformed themselves. And even talking to some of these folks over the last 6 weeks or so, straight from their mouth, I can tell they're uninformed. One in particular that said it would be unethical to do a unvaxxed study. There are none of those. It would be unethical to do it. There's 7 of them. They just didn't know. They're relying on these authorities, and the authorities aren't saying all the things you're saying, obviously. Right. So these doctors, if they continue to just listen to get their email inbox from American Academy of Pediatrics, they're not gonna.
Or the CDC.
Yeah.
Yeah. So that whole argument, it would be unethical. Here's why that doesn't hold up. Look at the COVID shot. So they actually tried to have a placebo group, right? It's a novel vaccine. Nobody's ever had it. So from the get-go, you start tracking the data and you compare the outcomes to those who didn't get it, because not everybody got it initially, to those who did. Unfortunately, in that trial, and they were trying to hide the data for 75 years, they already knew they had problems. And the problems were so great that they ended up encouraging the unvaxxed with their control group to get vaccinated so they could destroy the control group. But every time you add a new vaccine, it is the ethical thing, the proper thing to do is compare those who got the new vaccine to those who didn't. There will always be plenty of time before everybody gets it. And there are people who never get it, right? So the data is always there. We just have to have the will to look for it. Or I say, anytime you add a new vaccine, you do proper prospective long-term studies. Long-term, not weeks, days, months, years. So yeah, that's just a cop-out. We have plenty of data and we can get more.
Yeah. Yeah. Well, I just want to encourage the listeners, keep pressing on, digging for the truth, get informed. It's your responsibility to be informed. Remember, the standard American is on the last place team, getting the worst health outcomes. I'm encouraging the practitioners out there, the physicians and those in public health, to also be willing to dig and look and be willing to change your mind if that's where the data leads. And it'll be okay.
Yeah.
Even if you step outside those lines, it'll be okay. Look, Dr. Paul Thomas, he's still alive and going.
Happier than ever. So, when I lost my license, that was the worst day of my life. It was stressful. I mean, that's your career, right?
Yeah.
But it ended up, it's absolutely okay. I'm happier than ever. I am coaching families. We have a program at Kids First Forever. It's the number 4, kidsfirstforever.com. My partner, Dee Dee, who co-authored vaxxed, she coaches, I coach. I coach mostly on vaccine issues. There's so many folks out there who are stressed about, what do I do? There's this measles outbreak, or my partner doesn't agree with me. How do we navigate this?
Yeah.
And I can walk you through, because of my unique experience. Here's the thing, why would you listen to Dr. Paul? Why not just go listen to your pediatrician? Well, I was uniquely positioned because of all the things we've already talked about, to have a population of unvaxxed, partially vaxxed, and fully vaxxed, with large enough groups to be able to absolutely see what was going on. When I opened my practice in 2008, I made 2 waiting rooms, a well and a sick waiting room. And we had a glass wall between them so that the receptionist could deal with both sides, but the air was divided. I wanted to keep the thought of little babies sitting in a waiting room full of sick kids, which is what used to happen at my practice prior to this. And then they get sick. I mean, it's just like, that made no sense. So when I started in 2008, those waiting rooms were pretty equally full. By the time I retired in 2022, that sick waiting room almost never had anybody in it. The well waiting room was standing room only. I mean, they were jammed in there. Sometimes we just said, let's just open I put a sliding door on the glass wall. Let's just open it up and it'll all be well, because
That's amazing.
It was palpable. So, I got to live that. I got to see that. And if you're out there in fear, you don't need to be afraid of being unvaxxed. Being unvaxxed is the way we're supposed to be. The God-given natural innate immune system is powerful, incredibly powerful. Vaccines just stimulate antibodies. And by the way, you don't need antibodies to fight off infections. Antibodies are the last resort. I remember recently I met a man a few years ago who was in his 40s, I believe. He had gamma globulinemia. He had no antibodies, and he'd rarely ever been sick. I said, so were you getting those gamma globulin shots every month? He said, nope. My mom realized that, the immune system has other ways, and I could play in the dirt and do whatever I wanted. Incredible, right? He lived without any antibodies, so vaccines wouldn't have done him any good.
That's amazing. All right, there you heard it, folks. I mean, a doctor who sought the truth, followed the data, and ended up with an empty waiting room on the sick side and a robust overflowing. That's what we want. We want healthy kids, healthy outcomes. And in the United States, with our current protocol, we get the sickest. That alone is enough, much less the 2015 data that he pulled from his own practice. So it's so clear. Kidsfirstforever.com.
Yep.
And the number 4, kidsfirst4 ever.com. And then vaxxed, VAX, FACTS, book.com. Go check those out, guys. Dr. Paul Thomas, thank you so much for your life, for laying down your life for the kids, for the people, and doing all that you've done. It's a testament to your upbringing, your parents, your faith, and your love of the truth, and your trusting of God for provision, protection, and for his guidance through your life. It's just an amazing story. So thank you for being who God made you to be.
Thank you, Ben. Dr. Ben, you are one of my newly discovered heroes based on how you have handled this measles thing in Texas. You truly are a man of faith and a man of courage. And any doctor that's listening who might be questioning what's going on, it's not good for your career to do what you did. I can assure you. I mean, I'm sure you know that. But you followed your heart and your soul, and you knew this was what needed to happen. There were kids who were in danger, real danger. I mean, measles is not a joke. It's not something to be afraid of if you have the care of a doctor like Dr. Ben. There's things we can do. I'm not afraid of measles at all, but I am afraid of kids with measles being hospitalized because of what we've experienced. And we saw the same thing with COVID. So if you have a child who gets measles, get in touch with some of us doctors who know how to manage this before you even need to be in the hospital. And almost certainly we can keep you out of the hospital.
Yep. I concur 100%. And that's why I want to continue to have this conversation. Prevention, treatment, and hesitancy. Let's come to the table, be open and honest, transparent, and willing to say, I'm sorry, I got it wrong. And then we can heal and we can advance in this country. So hopefully we'll see that in the coming days, weeks, and months. Dr. Paul Thomas, thank you again for being on the show. Thank you for your books, your time, and everything you've done. We'll have to have you back someday.
I would love to. Thanks, Dr. Ben.
All right. Okay, everybody. I'm Dr. Ben Edwards. You're the Cure. This will be on all the podcast platforms and archived on our website, veritosswellnessmember.com. You can check that out under resources and podcast page. We'll see you next week. Bye-bye.